How often do you reach for an off-the-shelf painkiller? And when was the last time you read the label warnings? A University of Florida study reports that more than 80% of Americans report using acetaminophen, aspirin, ibuprofen, and naproxen each week. Many of us keep them on hand, not just at home, but in our purses and briefcases. So when Johnson & Johnson, the makers of Tylenol products, recently lowered the recommended daily usage of extra-strength Tylenol from 8 to 6 tablets daily, it raised questions about several painkillers across the industry. Specialists at Central Florida Pain Management say if you're going to use over-the-counter painkillers, there are some side effects you need to be aware of.
Acetaminophen, which is the medication in Tylenol and other products, has a potential liver effect. It needs to be associated mainly with alcohol. I would say that if you're taking 2,000 to 3,000 milligrams of Tylenol a day, which is 3,000 milligram extra strength Tylenol, I think, you're bordering the potential for any liver damage, especially if you have a glass of wine every night. Aspirin in all of the non-steroidals, because aspirin is the mainstay of the non-steroidal anti-inflammatory drugs, of which you have Advil, Aleve, Motrin, Celebrex. All of those are non-steroidal anti-inflammatory drugs. They all have potential kidney. So if you take a lot of them, and what is a lot is hard to say. They also have GI situations, they can bleed. So using over-the-counter medicines is not necessarily safer, but indeed it is a good step to do. And if it takes care of the pain and you use according to the box, it says take 1 or 2 pills twice a day, and you don't exceed that, then most likely you will be in the safeguard. Yes. Tylenol and acetaminophen and aspirin, or the non-steroidals, are effective analgesics. They really are. So they have a role. Sometimes I tell patients, go ahead and take an Aleve before you go, I'm using brand names, but take one of those medications before you go in golf, because it has preemptive value as an anti-inflammatory. And you might have less pain after from the muscle spasms, and it works. So yeah, they have a role. You just follow the label of the box. It's safe.
USA Today recently ran an extensive article comparing the benefits and potential dangers of several different pain medications. We've included a link to that article, along with the online version of this story. For more information on the treatments available at Central Florida Pain Management, please visit our specialist directory on yourhometownhealth.com.